Hola, muy buenos días. Gracias por conectarse a esta sesión informativa de la OPS sobre la pandemia por COVID-19 en la región de las Américas. Soy Daniel Epstein del Departamento de Comunicación de la OPS y esta sesión durará alrededor de 1 hora. Como cada semana ya hemos recibido algunas de sus preguntas por correo electrónico y también podrán hacer preguntas en vivo y a través del chat mediante el botón Q&A. Les pedimos incluir su nombre y su medio de comunicación, por favor, al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, portugués y francés, y que pueden optar por cualquiera de esos idiomas haciendo clic en el botón abajo que dice interpretación. Hoy, la directora de la OPS, la doctora Carissa Etienne, informará sobre la evolución de la pandemia en las Américas y sobre la situación en Haití. Acompañan a la doctora Etienne en esta sesión el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de Emergencias en Salud de la OPS, y el doctor Jairo Méndez Rico, asesor en enfermedades virales de la OPS. Ahora quisiera invitar a la doctora Etienne que nos comparta su actualización regional en el día de hoy. Dr. Etienne, please go ahead.
Thank you, Daniel, and good morning, and thank you for joining today's press briefing. Over the last week, 1.4 million COVID-19 cases and nearly 20,000 deaths were reported in our region. COVID infections are accelerating across North America, where routine surveillance has confirmed that the Delta variant has become the dominant strain based on the variant of concern sequences reported over the past month. The United States has seen cases increase by more than a third, and Canada by more than half. In Mexico, more than 2/3 of states have been deemed at high or critical risk as hospitals fill with COVID patients. COVID cases and deaths are also on the rise in Central America, particularly in Costa Rica and Belize. Meanwhile, most countries in South America are seeing a drop in new cases. Across Brazil, hospital occupancy is lower than 80% across all states for the first time since November. But transmission remains very active, so now is not the time for complacency. COVID infections and deaths are rapidly rising across the Caribbean. Puerto Rico, Jamaica, and Cuba continue an increasing trend in both cases and deaths, while in Trinidad and Tobago, weekly deaths continue to rise. In Jamaica, cases rose by 49% and deaths increased by 70%. We are seeing very steep rises in Dominica, Martinique, and Guadeloupe. The situation in Haiti is especially acute following the weekend's devastating earthquake. PAHO and the international community have activated teams in Haiti to support all aspects of the health response, and we PAHO are fully committed to help Haiti during this very challenging time. Sadly, among the earthquake's thousands of victims was Dr. Ousmane Touré, a dedicated PAHO epidemiologist who was supporting our response in Haiti. Our thoughts and condolences go out to his family and loved ones. Dr. Touré's loss is emblematic of the dangers that health workers face and the extraordinary sacrifices that they have made during this pandemic. Unfortunately, tropical storms and heavy rains have added new challenges to Haiti's frontline health workers, complicating the ongoing search and rescue efforts and the delivery of supplies. The situation in Haiti, and indeed across the region, underscores just how critical it is to bring this pandemic under control in the Americas in the shortest time possible. Yet across Latin America and the Caribbean, just 1 in 5 people have been fully vaccinated against COVID-19. And in some countries, fewer than 5% of people have been fully vaccinated. While PAHO is working actively to change this disparity, it will take months until our region has access to the vaccines that it so desperately needs. In the meantime, we must address the many consequences of this lasting crisis. So today I want to take this session to acknowledge just how difficult COVID-19 has been for our mental health and well-being. Throughout the pandemic, stress and fear have invaded our everyday lives, and an unprecedented number of people have lost their jobs and are struggling to support their families. More than 16 months since the virus arrived in our region, we have started to generate data that show the true breadth of COVID's impact on mental health in the Americas. And let me tell you that the results are grim. Demand for mental health and psychosocial support has never been higher. Yet these services have never been more out of reach. 3/4 of participating countries report partial or complete disruptions in mental health services during the pandemic. More than half of school-based mental health programs and more than 3/4 of out-of-school programs have been partially or entirely disrupted at a time when more than 15% of young people are experiencing depression. And nearly 90% of participating countries report that mental health counseling and psychotherapy services have been disrupted. Yet today, up to 60% of people in our region are suffering from anxiety or depression. These widespread disruptions have meant that many people who may be experiencing mental health challenges for the first time, including our frontline health workers who have been operating in crisis mode for more than a year, they all lack the support that they need to adequately manage their conditions. And people already living with mental health disorders have struggled to access medications or essential therapies, which can worsen their conditions and leave them vulnerable to crisis. So today, we are facing a mental health crisis that, if left unaddressed, will have severe consequences. It will not only worsen the mental health burden in our region, but also prolong the pandemic's impact. While many countries have deemed mental health a priority and have integrated mental health support within their COVID-19 response plans, few have backed these promises with funding or have put these plans into action. And so that is why we urge countries to please follow through on your promises by investing in mental health programs. A few countries are already doing this well and offer a model for our region to follow. Chile has launched a mental health campaign with the support of its president to strengthen psychosocial services during the pandemic, including by expanding the mental health workforce and offering mental health support to health workers and building up community-level care to reach more people closer to home. In a recent survey of health workers in 30 countries, 35% of these health workers said they needed psychological help, but only 1/3 of them had received it. Trinidad and Tobago has also reorganized mental health services to bring them directly into communities. It has launched helplines, telehealth services, and online directories of mental health professionals to ensure that people can always access the mental health support that they need. Costa Rica is also conducting multiple studies to better understand the mental health impact of the COVID-19 pandemic, to better inform their response, and to serve as a reference for other countries in the region. To support our member states, PAHO has updated guidance to ensure health workers can meet patients' evolving needs amid ongoing COVID disruptions. And we are also working with countries to reduce stigma in our region, because everyone who needs mental health support should feel comfortable and safe asking for help. Mental health services are foundational to our COVID-19 response and ultimately to our recovery and rebuilding process. Countries must invest in mental health now to weather the ongoing threat of the pandemic and to limit its ripple effects for years to come. This pandemic is a reminder that good mental health is a linchpin for our region's health and the well-being of our societies.
Thank you very much, Dr. Etienne. We have a lot of questions from journalists, and I'm going to start with two that are asking about the same thing, which is vaccination. And I think this would be a question for Dr. Barbosa. It's from Yerson Collave del Comercio Perú, la voy a leer en español, que dice que las campañas de vacunación avanzan en los países de la región a diversos ritmos. Antes se hablaba de un 70% de vacunados para controlar la epidemia, y ahora algunos expertos hablan del 85%. También Alina Dieste pregunta, ¿qué regiones y países preocupan más a la OPS por estar rezagados en la vacunación anti-COVID? Entonces la pregunta sería esa, y en este contexto, ¿cuál es el porcentaje de vacunados que recomienda la OPS? ¿Hay algún cálculo sobre el momento en que se llegará a ello en la región? Doctor Barbosa.
Gracias por la pregunta. Sin duda que hay mucha expectativa de las personas para saber exactamente cuál es el porcentaje de cobertura vacunal que va a ser necesaria para controlar la pandemia, para terminar la transmisión. Lo que pasa es que es una enfermedad nueva, un nuevo virus, hay nuevas variantes. Así que todo lo que tenemos hoy son modelos. Los primeros modelos hablaban efectivamente de que un 70% podría ser una proporción adecuada de la población vacunada para alcanzar el control de la transmisión. Ahora hay nuevos modelos que hablan de 80 a 85%, lo que es un desafío todavía más grande, porque va a necesitar incluir en la vacunación los adolescentes y quizás los niños. No tenemos hasta ahora ningún país que ha alcanzado 80% de personas con las dos dosis de vacunas. O sea, no tenemos un dado fuerte de la vida real para comprobar cuál es la proporción necesaria. Sabemos que es necesario vacunar mucho. Sabemos que va a ser necesario al menos un 70, 75, 80%. Así que todavía es importante mantener las estrategias, buscar brindar todas las informaciones a las personas que pueden se vacunar para que efectivamente tengan acceso a la vacuna, hacer siempre hincapié de la necesidad de completar la vacunación con las dos dosis, porque ese es el camino para alcanzar el control de la transmisión. Los países que primero van a alcanzar este patamar van a fornecer dados muy importantes, pero sabemos que con 40, 50% que muitos países já lograram, não é suficiente para controlar a transmissão. Assim que há que seguir vacunando, completando a vacinação com as duas doses e buscar alcançar a todos os grupos que estão em los planos nacionais. Gracias.
Gracias, doctor Barbosa. Muy interesante y muy importante. Ahora tenemos dos preguntas de México que las voy a pasar al doctor Ciro Ugarte. Una es de Mata Rodríguez de Justicia TV y la otra es de Melina Ochoa de Uno TV en México. Y ella pregunta, ¿hay preocupación en México por el incremento de contagios de COVID-19 y en particular de la variante Delta en niños que están ingresando a hospitalización y cuidados intensivos? ¿Por qué no se ha considerado a este sector en la protección de vacunas? ¿Y cuál es el riesgo de volver a clases presenciales a finales de este mes en México? Y si es justificada la alarma de la sociedad sobre contagios en niños. Melina Ochoa pregunta más o menos lo parecida. ¿Considera la OPS que en 2 semanas México registrará un descenso de contagios de coronavirus? Y la OPS recomienda a los niños, niñas y adolescentes regresar de manera presencial a las aulas. Doctor Ugarte.
Gracias, Daniel, y gracias a Marta y a Melina por estas importantes preguntas que en realidad son de mucho interés para casi todos los países de nuestra región. En el caso de México, la propagación de la variante Delta, que afecta a muchos países en el mundo, también está afectando a México, y actualmente la variante Delta representa más de un 92% de las cepas circulantes en el país. Esta variante de preocupación se caracteriza, como sabemos, por la mayor transmisibilidad y afecta también a categorías de grupos poblacionales más jóvenes, incluyendo adultos jóvenes, adolescentes y niños, en proporciones más elevadas que las otras variantes. La campaña de vacunación en el caso de México contempla la prioridad al personal de salud, adultos mayores y grupos de edades mayores, pero a las personas que viven con comorbilidades, por ejemplo. Sin embargo, tenemos entendido que se está discutiendo la vacunación para niños de 12 a 17 años y que la decisión sería tomada pronto. En este contexto, el proceso de reapertura de los centros de estudio de forma presencial debería estar basado en un análisis de la intensidad de la transmisión en el lugar donde se encuentran los centros educativos, el lugar de residencia de los estudiantes y considerando los medios de transporte para llegar a los centros educativos y retornar a los domicilios. Por tanto, la reapertura de escuelas no puede ser una reapertura generalizada, debe estar basada en una evaluación de riesgo local, la situación epidemiológica, la capacidad de respuesta, la disponibilidad de los servicios de salud y las condiciones propias de los centros educativos en todos los niveles, escuelas, colegios, universidades. Es muy importante implementar mecanismos eficientes o mejorar los mecanismos para la notificación inmediata de los síntomas que pudieran aparecer en los centros educativos, una vigilancia epidemiológica y el diagnóstico rápido, con el fin de tomar medidas oportunas para reducir la transmisión si es que aparece. Hemos visto muchísimos ejemplos positivos de esta medida. Es decir, cuando se encuentran niños o maestros o personal de las escuelas, los colegios, los centros educativos que presentan síntomas, se toman medidas inmediatas, pero solo si es que este mecanismo de reporte está adecuadamente organizado. México lleva más de 50 millones de personas vacunadas con una dosis y alrededor de 30 millones con esquema completo. Y más del 50% de los mayores de 18 años han recibido vacunas. Sin embargo, a pesar de este importante esfuerzo y que se ha disminuido significativamente la mortalidad o la letalidad por COVID-19, estamos aún lejos de estar en una proporción de protección que son requeridos para reducir la transmisión. La OPS y la OMS han emitido recomendaciones y documentos de orientación específicos respecto a la reapertura de las escuelas, las actividades educativas presenciales y otros más. En ese contexto, la OPS recomienda que en este proceso hay un aprendizaje que todos debemos estar al tanto y que, por ejemplo, el uso de mascarillas en situaciones en las cuales no se puede mantener la distancia física se recomienda en niños mayores de 5 años. Esto obviamente implica un proceso de toma de decisiones más amplia y complejo, pero hasta la fecha lo que estamos viendo es que con todas estas recomendaciones, las decisiones siempre son del nivel local y por lo tanto debemos seguir vigilando cuál es la situación de nuestros estudiantes, de los maestros, del personal educativo y de las familias en las zonas donde se está planificando la reapertura de las escuelas. Gracias.
Muchas gracias, doctor Ugarte. Veo que las preguntas sobre vacunas siguen llegando y son muy importantes. So let me switch to English because we now have an important question that I think Dr. Etienne could answer, which is about the vaccine boosters. It comes from Tanya Smith Cartwright of the Tribune in Nassau, Bahamas. And Tanya asks, does PAHO recommend that regional communities look toward taking the booster shot, which is now being recommended in the United States for all citizens? Dr. Etienne?
So let me thank Tanya for this question. Each country makes its own decisions about the vaccination strategy it uses, considering the availability of vaccines, the transmission of COVID, and other factors. At PAHO, our expert group, along with the WHO SAGE group of experts, have advised that the most urgent priority is to expand vaccinations to all health workers and vulnerable people in our countries. As I alluded to earlier, although we have made some advances in vaccinations against COVID-19, they are not enough. So to date, just over 21% of people in Latin America and the Caribbean have completed their vaccination schedules. This means that we have millions of people who are not yet protected. In some countries, many people have not yet received their second dose of the vaccine, which is critical to ensuring protection. So with respect to the third dose of or the boosters, we still have no concrete evidence, certainly not from SAGE, to make a recommendation for a third dose. So studies, clinical trials, and data collection are ongoing to gather more evidence in many countries. I can assure you that once that data is analyzed, that WHO will put forward a recommendation, and that will be done, I hope, in the near future. But if you ask me, our most urgent priority is to ensure that all countries have access to vaccines and that no one is left behind in each country. So donations of vaccines, COVAX purchases, and direct purchases by countries have not yet succeeded in getting the Americas the vaccines that we need to reach our eligible population with just the basic coverage. We still have a long way to go to vaccinate our people against COVID-19, and we continue to plead for additional donations of vaccines from those countries that can spare them. And this shortage is why last week we announced that PAHO is offering to our member states a new opportunity to access the COVID-19 vaccines through the PAHO revolving fund. And to date, we have received requests for vaccines for both the last 3 months of 2021 and for the calendar year 2022. So meanwhile, it is crucial that we continue to observe the public health measures, including wearing masks, social distancing, adequate ventilation, and avoiding crowded and closed spaces, and the other measures to reduce transmission and protect ourselves. These public health measures have proven to be effective. Over.
Thank you, Dr. Etienne. We have a question that I think Dr. Barbosa would be able to answer from Guardian Media in Trinidad and Tobago, Kevin Fellmine, on this same theme. Dr. Barbosa, Kevin Fellmine asks, are there cases of people who have recovered from COVID-19 contracting the disease again? Does recovering from the disease provide any immunity? And do we have any statistics regarding these reinfections with the same strain or with different strains?
Okay, thank you for these many questions. They are very important. First, yes, a person can get COVID-19 a second time. This is very well established already. Probably these people are getting a limited protection from the natural infection, and they can get the COVID-19 again from the same virus or from a variant, if a new variant is circulating among the community in this country. So yes, it is possible. We know that the protection provided by the natural infection is limited, so it's very important, even for people that had the disease, they need to get the vaccine. Some people, they share the false information that people that got the natural infection are better protected than the vaccine. This is not true. So even people that had the disease, they need to get vaccinated. We don't make the genome sequencing in each case. So the surveillance is very important for new variants, but it's made only in a sample of cases. So we don't know case by case what is the variant related to that case. But when we look to the data that we have, it is concerning that with the Delta variant now, we are seeing more cases in people that have already received the vaccines and even people that had the disease. So it's very important to get vaccinated. The vaccines are working against the new variants. We need to monitor, to follow up, to have good surveillance systems in place to monitor the effectiveness of these vaccines against these new variants. But the best way to be protected against them, to avoid having a new infection or to have a breakthrough infection, is to get fully vaccinated. And while there is community transmission, maintain to keep all the protective measures that we know that are effective. Wearing masks, avoiding crowded, closed spaces, and other measures that can prevent not only for the original virus, but also for the new variants. Thank you.
Thank you very much, Dr. Barbosa. And I want to take advantage of the fact that we have Dr. Jairo Mendez here, since we're talking about variants, and he is our expert on variants. I think what we would ask Dr. Jairo is, lo hago en español porque así es la pregunta de Nicaragua. La OPS tiene información sobre la situación de variantes del SARS-CoV-2 en Nicaragua y en otros países de Centroamérica. ¿Nos podría poner al día un poco, doctor Méndez, sobre cuál es la distribución y la situación de los variantes?
Muchas gracias por esa pregunta tan importante. Como parte de la cooperación técnica, OPS ha tratado con todos los países y ha enviado insumos y reactivos necesarios para el tamizaje y detección de variantes de preocupación del virus SARS-CoV-2, no solo a Nicaragua, sino a por lo menos 23 países y territorios más en la región. En este momento no tenemos una información concreta sobre la detección de variantes de interés de preocupación en Nicaragua. Sin embargo, sabemos que el Centro Nacional de Diagnóstico y Referencia, el CNR, ha estado trabajando intensamente para aumentar su capacidad y muy seguramente tendremos la información muy pronto. Es importante mencionar que gracias al esfuerzo de Guatemala, Honduras, El Salvador, Costa Rica y Panamá principalmente, y la colaboración que han tenido muy cercana con la Red Regional de Vigilancia Genómica de OPS, ha sido posible demostrar en esta subregión de Centroamérica la circulación de diferentes variantes de preocupación, incluyendo la alfa y la gamma principalmente, y en una muy menor proporción la variante beta, las cuales están co-circulando con otras variantes que denominamos de interés, tales como la variante iota o la variante lambda. De acuerdo con los datos disponibles hasta el momento en Centroamérica, La circulación de la variante Delta, que por supuesto tanto preocupa y tanto inquieta, solo ha sido demostrada realmente en Costa Rica. Sin embargo, ha sido notificada oficialmente su detección en otros países como en Panamá y en Guatemala, en donde ha estado más ligada a viajeros. Sin embargo, por supuesto que la estamos vigilando muy de cerca. Sin duda alguna, la vigilancia sostenida de la vigilancia genómica sostenida nos permitirá detectar a tiempo la introducción de otras variantes y, por supuesto, hacer seguimiento más cercano a la variante Delta en todos nuestros países. Gracias.
Muchas gracias, doctor Méndez. Y ahora nos gustaría preguntar al doctor Ugarte sobre la situación en Venezuela. Violeta Villar, de la Web de Salud, nos pregunta si podemos dar una actualización de la situación de vacunación en Venezuela, las dosis llegadas por COVAX, y qué recomienda la OPS a quienes no pueden vacunarse con segundas dosis por falta de suministro. Doctor Ugarte.
Gracias por esa pregunta. Bueno, no tenemos información detallada y actualizada sobre la vacunación en Venezuela. Sin embargo, esa información normalmente se comparte en las reuniones internas que tiene la OPS, la oficina de la OPS en Venezuela, con el gobierno, con el programa de inmunización. En ese sentido, estamos haciendo seguimiento de los preparativos para la llegada de las vacunas adicionales. Y nuestra recomendación, como se ha dicho anteriormente, es que las personas que todavía no se han vacunado deberían extremar las medidas de distanciamiento físico. Y quizá complementando la respuesta que hizo Jairo temprano, respecto a la circulación de las variantes, es muy importante recordar que las medidas de salud pública que se han insistido, que lo ha dicho el doctor Yarba, la directora, muchas veces, y en esta misma conferencia de prensa, han demostrado que son altamente efectivas para reducir la transmisión del virus y todas sus variantes. Así es que es importantísimo mantener estas medidas, principalmente el uso de mascarillas, desinfección de manos, distanciamiento de al menos 1 metro de otras personas, evitar congregaciones de personas y, por supuesto, cuando aparecen los síntomas, inmediatamente tomar las precauciones para aislamiento de los casos sospechosos y cuarentena de los contagios. Estas medidas han demostrado ser altamente eficaces y esa es la recomendación principal a aquellas personas que no se han vacunado y no tienen disponibilidad de vacuna. Sin embargo, aquellas personas en cuyo país, en cuya localidad existe disponibilidad de vacunas, deberían decidir lo más pronto posible en aplicarse la vacuna. Está demostrado también ampliamente que la gran mayoría, más del 95% de los casos que se presentan en los hospitales, que es hospitalizaciones, se presentan en personas no vacunadas. Y esto es un dato extremadamente importante para motivar a todas las personas que todavía tienen preocupación o todavía están esperando alguna otra oportunidad, alguna vacuna mejor que esté disponible, a que se apliquen la vacuna que tengan disponible, porque eso será en muchos casos la diferencia entre la vida y la muerte. Gracias.
Gracias, doctor Ugarte. Y este tema nos lleva a una pregunta muy parecida o sobre el mismo tema que nos gustaría pedir al doctor Jarvas. Es una pregunta que viene de Annalisa Paul y dice, can we provide an update on how PAHO's public education campaign has progressed insofar as it has been able to address vaccine hesitancy? Dr. Barbosa?
Thank you for this question. Vaccine hesitancy is a very important issue that we need to address during all this process that we are dealing with so many challenges in this pandemic. Since the beginning, we have called the attention to the Ministry of Health that you need the vaccine, of course, but you need also many other important initiatives to get a good vaccination campaign. You need to train the health workers, you need to establish an assessment about the cold chain capacity, you need to establish a very comprehensive communication strategy. You need to address all the rumors, the conspiracy theories, the false information that are circulating against the vaccines. This is very important. We are working with the Ministries of Health since the beginning. We had 2 workshops that were open to journalists, one in Spanish, one in English, to clarify all the doubts, to explain how a vaccine is produced, what are the standards to assess a vaccine, its quality, its safety, its efficacy. So we are working with the Ministry of Health. We are identifying some sub-regions in the Americas that the vaccine hesitancy is a very important problem. This is the situation in the Caribbean. We had a survey with healthcare workers specifically about the vaccine hesitancy, and we are working now with the Ministry of Health in the Caribbean and in South America and in Central America also to address this issue. It's very important. This is not a regular vaccination campaign. This is a vaccine that unfortunately has been targeted by anti-vax groups, that been targeted by people that deny the pandemic. So it's very important to have a very strong and comprehensive communication strategy to provide transparent information to communities, healthcare workers, to the families, so they can make the best decision to get the vaccines that can save lives and can control the transmission of the virus. Thank you.
Thank you, Dr. Barbosa. We have now a question from Carmen Paun of Politico with a specific issue on Haiti that perhaps Dr. Ciro Ugarte can answer. And she asks, what was the status of the COVID vaccination campaign in Haiti before the earthquake, and has it been entirely disrupted by now? Dr. Ugarte?
Well, yes, I will begin answering the question, and maybe Dr. Jarbas may complement. Okay, I would say that Haiti, after they received the vaccines, all the vaccines were deployed to many vaccination points that were organized ahead of the arrival of the vaccines. And although the vaccination during the first days and weeks were very slow, it had increased the vaccination to the population in several areas of Haiti before the earthquake. Clearly, the situation of the earthquake, particularly in the southern area, but also in the entire country, will be affected because of the logistics, the security, and the humanitarian situation, but also because, understandably, the priority of the health personnel and health authorities is to save lives and reduce the impact of the earthquake in many areas. And also, a lot of healthcare workers are overwhelmed treating trauma patients and evacuation of patients, but also treating other diseases and trying to reestablish the health services that have been impacted by the earthquake. So in that regards, the vaccination will be impacted, but we will continue supporting the Ministry of Health of Haiti and all other partners, including the private sector, to continue the vaccination and eventually to increase the pace so we can vaccinate more people, because as we know, after the earthquake, many people will not have the ability to implement all the public health measures and social distancing or physical distancing and others, and will increase the risk of transmission of COVID-19. So, Jarbas, can you complement this?
Yes, thank you, Ciro. Just to complement, as Ciro mentioned, 3 weeks ago, PAHO deployed 500,000 doses to Haiti. This was a donation made by the US government through COVAX facility. So the vaccines are there. We we also all supported the Ministry of Health of Haiti to decentralize these vaccines. Now these vaccines are being deployed to 12 provinces in Haiti, and the vaccine is starting with the healthcare workers. That is the priority, the first priority group, and after that, elderly people and people with some underlying health condition that can be a threat, it can be a risk to develop a severe form of COVID-19. Until yesterday, 21,000 people have been vaccinated in Haiti. We are working with the Ministry of Health to expedite the process, despite all the challenges that Haiti is facing, because as Ciro mentioned, now in these areas that were affected by the earthquake, we can have people in shelters and people that are dealing with some very, very critical situations. So it's important to have the access to the vaccines. We are working with the Ministry of Health, and our expectation is that we can increase the pace of vaccination in the next weeks. Thank you.
Thank you, Dr. Barbosa. And I know that Haiti is on the minds of everyone at PAHO, in our Port-au-Prince office, in our Dominican Republic office, in our offices through the Caribbean. And Dr. Etienne has been very closely involved in the response to Haiti. So I would like to ask her to answer a question from the New York Times, which is, how is hurricane season expected to impact COVID-19 response in the Caribbean? And how has the storm impacted Haiti and our response? Dr. Etienne?
So thank you for this question. Of course, hurricanes and storms interrupt healthcare systems. They affect people's lives, livelihoods, housing, and with those disruptions, it is much harder to ensure compliance with public health measures. Also in the Caribbean, we do have, as Dr. Javas mentioned, we do have significant vaccine hesitancy. So we expect that with disruptive storms and hurricanes, the potential for the increase in cases is very high. Of course, you know that Caribbean countries, Caribbean countries do have limitations in terms of their health systems. And so if in a Caribbean country, you have to deal with the after effects and health effects of a hurricane or a storm that causes much impact on people's health in terms of trauma, etc., and also some other diseases that follow in the wake of hurricanes. That places another burden on the healthcare system, and clearly very quickly would compromise and overwhelm those systems. So we are very vigilant. Now, in terms of Haiti, we realize that the earthquake there has caused significant disruption in lives and livelihoods, and is also impacting on the health system to merely be able to deliver the care that people require now, in the light also of tremendous difficulties in moving supplies, in moving personnel, and etc. So this is an added burden for both the people and the government of Haiti. And we've not been able to deploy sufficient numbers in terms of EMTs, the emergency medical teams. We are working on this, but clearly that area of Haiti and Haiti requires the assistance, and we are helping the government to coordinate all of those supplies, equipment, emergency management teams. Thank you. Over.
Thank you, Dr. Etienne. We have a question that I think Dr. Barbosa would be able to answer, which some people would consider a silly question, but this is kind of the infodemic misinformation that many public health people are faced with frequently. And this comes from Marcelo Blanco de la verificadora Bolivia Verifica. Y pregunta, doctor Barbosa, ¿hay algo de cierto en las afirmaciones que dicen que las vacunas son tóxicas porque contienen grafeno, acetona, aluminio, mercurio, partículas de cadáveres de animales, de vegetales y desechos humanos? ¿Qué podríamos decirles a las personas que dicen que quienes se vacunan son suicidas porque voluntariamente se colocan una vacuna que hará daño a sus organismos?
Gracias por la pregunta, Marcelo. Desafortunadamente, as vacunas para COVID-19 han sofrido todo tipo de informações falsas, de rumores, de teorias de conspiração. Primeiro, não é verdade que tenha nenhuma dessas substâncias em nenhuma vacuna. Os estándares para as vacunas são mais elevados que os estándares para os medicamentos. São estándares muito elevados que são estabelecidos por expertos no mundo inteiro. São os mesmos estándares que utiliza a OMS para regalar a autorização de uso de emergência, que utilizam as autoridades reguladoras de todos os países. Então, quando uma vacuna, para ser aprovada, o uso de uma vacuna, primeiro se verifica se a qualidade do fabricante da vacuna está no estándar que se requer. Ou seja, não é qualquer fabricante que pode pôr uma vacuna. Antes, tem que comprovar que siga todas as boas práticas de fabricação. Segundo, se verifica a segurança dessa vacuna. A seguridade de uma vacuna que se estabelece desde os ensaios pré-clínicos, com testes em animais, depois com os ensaios clínicos em pessoas, em humanos. Todo isso se vai comprovando e depois com a própria utilização da vacuna. Hoje já temos mais de 1.000 milhões de pessoas no mundo que foram vacunados, ou seja, seguramente que é uma das vacunas mais monitoreadas de toda a história. E terceiro, também, a vacuna tem que comprovar que é eficaz. Então, as vacunas são seguras, são eficazes, as vacunas que se utilizam, e é ao revés. Não são suicidas os que tomam a vacuna, são suicidas os que não querem tomar as vacunas. Esses têm um risco que pode ser 99 vezes mais grande que uma pessoa que está vacunada de desenvolver uma forma grave de COVID-19 e de morrer. Assim que as pessoas que podem vacunar-se e todavia não estão se vacunando, estão correndo um risco de vida, estão ponendo também a sua família, a seus contatos mais cercanos em um risco muito elevado de desenvolver uma forma grave de COVID-19. É muito importante que se compartam as informações, que quando em las redes sociais há informações como mira el video que nadie quer compartilhar, mira lo que habló ahora el médico que está a revelar el segredo por detrás de las... Tenha muito cuidado com esse tipo de informação. Em geral, são notícias falsas. Busquem na página da OPS, na página da OMS, onde há muitas informações, todas as informações que podem se verificar e basadas no melhor conhecimento científico que temos. Gracias.
Thank you very much, Dr. Barbosa. Y es importante que informemos sobre esos informaciones falsas, porque realmente es increíble qué tipo de cosas puede creer la gente. Así que muchas gracias por esa respuesta. Estamos casi llegando al final de la sesión. Tenemos unos cuantos minutos más, pero hay mucho interés en Haití y vamos a preguntar a Dr. Etienne. We had a question about Haiti from the New York Times and from several other reporters for an update on what has been the effect of the hurricane in Haiti, and what is it that PAHO is doing? Can you perhaps give us some of the details of our activities there, Dr. Etienne?
So let me thank you for your interest in Haiti and for your question. So the needs are immense in Haiti right now. People need safe water, they need food, home essentials, and other basic goods. Hospitals in Lekai, in Jeremy, and in Baradere are overwhelmed and require human resources and emergency support, medicines, and supplies. As of August 17th, according to the Haiti Civil Protection Agency, at least 1,941 people died and over 10,000 people were injured, along with heavy damages to more than 12,000 homes. We have trapped victims and overwhelmed hospitals, especially in the department of Guarans, Nip, and Sud. The urgent health needs that were identified by Haiti's Ministry of Health include to mobilize general and specialized medical personnel to the affected zones and to obtain medicines and medical supplies such as anesthetic drugs, orthopedic external fixators, and others. They also need logistical support for the delivery of supplies and the transfer of patients. PAHO and the ministry have deployed 3 teams to the South Department, Sud Department, to conduct rapid assessments of health institutions, to guide the rapid response actions, and to set up information reporting systems. Our staff is being deployed to the Guanans and NIP departments to support reestablishing health services at departmental levels. So in total, 24 health facilities suffered damage, mainly first level of care. In Guanans, 3 health facilities were destroyed and 2 were damaged. In NIP, we found that 1 health facility was destroyed and 4 damaged. And in Sud Department, 14 health facilities have been damaged. Of course, we also want to be able to track any waterborne diseases resulting from water and sewage pipes that were broken, as well as cases of COVID-19. So at this stage at PAHO, our priority is to support the operation of health services and to help save people's lives. We are working closely with Haiti's Ministry of Public Health, with their Civil Protection Service, and with UN agencies, and with other partners to assist Haitians with vital needs. PAHO has already delivered essential medicines and other medical and surgical supplies to the Sud Health Directorate for distribution to health institutions in need, and certainly more help is on the way. Our country office in Haiti is coordinating the response with help of our office in the Dominican Republic and the support of PAHO's Health Emergencies team in Washington, Barbados, Colombia, and Panama. The National Unit for Health Emergencies of the Ministry and PAHO are working together in the Crisis Center in Port-au-Prince. As I mentioned earlier, our hearts go out to the people of Haiti, and rest assured that we are doing everything possible to assist Haitians in these difficult and hard times. The earthquake aftermath, combined with the COVID-19 pandemic, presents a very challenging situation for the people of Haiti. So what we need is health personnel, supplies, and equipment to treat patients with trauma, injuries, acute illnesses, chronic diseases, and mental issues. There is an urgent need to restore health services, mainly in the most affected areas, and to ensure adequate water and sanitation to prevent increases of diarrheal, respiratory, and skin diseases. So donations should be geared towards meeting the needs that have been identified by the health authorities and institutions with presence in the affected areas. We certainly hope that the international community can come together to help and provide the urgently needed air and ground logistics support to evacuate patients and transport essential humanitarian supplies, and this is needed now. We will continue to support the health authorities on their response to COVID-19 and also the ongoing vaccination campaigns and towards reestablishing health services. But today, I also want to make a special appeal to the people of Haiti. Jodia, map mande tout haïtien, tant al vacciner. Pour j'en a pile vaccin qui disponible. Tant pis, point pour protéger tête ou famille à communauté que côté wap vive là. Al vacciner. Vaccin, yo sans danger, normalement. Souple. Al vacciner. Thank you for joining us today.
Thank you, Dr. Etienne. And I think that's probably the first press briefing where we've had Creole spoken, and I hope that many people will understand that. We have reached the end of our press briefing. We want to thank all of our panelists and remind you that you can find more information about COVID-19 on PAHO's web pages, paho.org/coronavirus. Thank you very much for connecting with us, and sigamos cuidándonos, por favor. Gracias.